Hello, everyone, and welcome to the Life Unites Us webinar, Understanding Substance Use Disorder Among Older Adults. My name is Ashley Narvaez. I'm a program manager here at Shatterproof. Very excited to be with you all and to welcome our speaker on this very important topic. So as you all start getting into the room, feel free to drop your name, your organization in the chat. Always really excited to see who's in the room with us. So I'll start with a brief rundown of what we hope to cover today. After some housekeeping, we will dive into an overview of the campaign in case you're new to Life Unites Us. We'll then transition to a speaker introduction, and our speaker will give their presentation, and we'll wrap up with a Q&A at the very end. So just in terms of some housekeeping, again, feel free to introduce yourself in the chat. I do want to mention that our webinar will be recorded and that a copy of the presentation will be available on the Life Unites Us website along with the recording. Certificates of attendance are also available upon request, so you can just shoot me an email and I'm happy to provide that for you. All attendees will be muted throughout the course of the webinar, but please use the Q&A button at the top of your screen to ask any questions that you might have. The chat is also available for your use throughout the webinar and will be monitored. To adjust your view and see all the speakers or panelists, you can click View at the top of your screen and then select Speaker or Gallery. And then to access closed captioning, you can click More, select Language and Speech, and choose Turn on Live Captions. All right, so we'll jump into a quick overview of our Life Unites Us campaign. So Life Unites Us is an evidence-based public health intervention designed to reduce addiction-related stigma of substance use disorder in Pennsylvania. We've been active in the state now for 5 years. The campaign is a collaboration between Shatterproof, Penn State, and the Public Goods Project, in close partnership and funded through the Department of Drug and Alcohol Programs. In terms of our goals, we're working to increase knowledge around substance use disorder, and that recovery is not only possible, but probable. We're improving attitudes towards individuals with SUD, and we're also strengthening the capacity of stakeholders who are already responding to the work on the ground. In terms of our pillars of work, there's a few ways that you can get involved with our campaign. So we regularly connect with community organizations on the ground to make sure that our campaign is leveraging their perspective. We have a community impact committee that is made up of community leaders across the state of Pennsylvania working in the substance use disorder space. We meet with them on a regular basis to make sure that we're guiding the direction of our work with their feedback. In terms of content sharing, the bread and butter of our work focuses on collecting stories from folks with lived experience, their friends and family members, people working on the ground, and then sharing those stories on our social media channels to promote messaging that speaks to hope and recovery. And in terms of our education arm, we host webinars on a quarterly basis. We always welcome different topics, ideas for things that we can cover, all in the hope that we're providing you all with the tools that you need to have these conversations and contribute to the narrative. So with that, here's a few examples of some of our content. We have a story library that you can visit on our website where we have all the stories that we've ever collected with the campaign. We also have ready to download and share assets that you can use on your own social media channels. Just a quick pitch to follow us online. We are on Instagram, Twitter, and Facebook. You can visit our website to sign up to be a partner. We'll also have the link dropped in the chat. And if you're interested in sharing your story, we'll be dropping that link as well. Or you can also scan this QR code, which takes you to our Tell Us Your Story form and walks you step by step through the process that you can follow. Well, that we'll turn it over to our speakers. So I'll go ahead and introduce Lynn Cooper. Thank you so much for being with us today. Lynn Cooper is a behavioral health policy specialist at the Pennsylvania Association of Area Agencies on Aging. She has over 46 years of experience in public health and over 29 years of experience working on regulatory and policy issues for mental health and substance use disorder treatment providers. In her role at P4A, she works to improve access to mental health and substance use disorder services in the Commonwealth for older adults. Ms. Cooper celebrated 35 years in recovery in January of 2025, and through her personal experience with her mother, has supported someone facing mental health and substance use challenges later in life. So Lynn, I'll turn it over to you.
Awesome. Thank you very much. Can you hear me okay?
We can hear you. Yes.
Great. Great. Well, first of all, I just want to say thank you so much to Ashley for this invitation. I am beyond thrilled. Any chance that I can spend time talking about the need to improve access to mental health and substance use disorder services for older adults. So I'm so grateful, and I'm super excited because as I was waiting, I was looking at some of the names of the folks that are here with us today and where you're from. And I am just absolutely thrilled to pieces. We have a number of folks here from the Department of Drug and Alcohol Programs. We have lots of folks here from county drug and alcohol programs. My dear friend, Cindy Wanamaker is with us, who is a member of the Older Adult Committee for the Mental Health Planning Council. Oh my gosh, I could go on and on, but I won't. But I just want to tell you how excited I am to have you all here. And you heard my background. I have worked in this arena for many years. Most of it has been working on regulatory issues for mental health providers and substance use disorder treatment providers. And I was hired about 4 years ago, specifically to assist the area agencies on aging to access mental health and substance use disorder services for the older adults that they serve. Our AAAs were having a very difficult time when they encountered someone with some of these challenges and trying to provide them care. So I've been working really on 3 levels. I've been working on a statewide level, and that's the kind of work that I'm doing with Cindy Wanamaker on the Older Adult Committee of the Mental Health Planning Council. I've also been fortunate, which I'll talk more about later, to be a part of some other very important statewide initiatives where we're screaming from the rooftops about the needs of older adults. And the second arena that I work in is on a county level, where we have a number of task forces, and I'll be talking more about that also later, on a county by county basis, that are folks that are interested in working on aging and behavioral health issues and improving access there. And I'm very grateful to have some wonderful relationships with county mental health providers and substance use disorder providers and administrators also that I can work with, along with the all important managed care companies. And I noticed that Perform Care is one of the folks here, and so grateful that you're here listening to this. The message is we need to do more to improve access for our older adults. Next slide, please. And this is just a little bit about who I represent. There are 52 area agencies on aging across the Commonwealth, and there's one in every county. And if you do not know anyone at your AAA, I strongly encourage you to make a phone call. And that includes everybody here. If you have any interest in serving older adults, you need to make sure serving the needs of older adults as it relates to mental health or substance use disorder. And I don't mean providing the service, but accessing it. It's so important that you get to know your county mental health administrator and your county drug and alcohol administrator. And I failed to mention, which is probably more important because I work for all of them, there are quite a number of my members that are also with us today in this seminar from various area agencies on aging. So thank you all, and thank you all for the work you do. But what we have come to realize is that despite all the great work we do, which is assessments and referrals and services, our goal is wholly and solely to help folks maintain physical health, independence, and quality of life. It's our job at the AAAs to make it possible for older adults to age in place. But I'm here to tell you that we do not provide mental health services or substance use disorder treatment. That's why we need our community providers to help us. But what you'll also hear more about is how difficult it is for an older adult to maintain their independence and their health if they have a mental health problem or a substance use disorder that goes untreated. And this is who I work for. We're often referred to as P4A. We're the state association that represents all 52 AAAs. I like to think of myself as having 52 bosses because I represent every one of our AAAs. And again, the work they do is just absolutely amazing. And it's the job of our state association of P4A to do everything we can to help our members accomplish their goals. And this is what I focus on primarily. And I need you to know that our members have long recognized the need to improve access to mental health and substance use disorder services. The whole gamut, prevention, intervention, referral, treatment. We see the need, we've seen it for a long time, and we see it at all service delivery levels. We see it when we're delivering meals. We see it certainly with in-home care, housing, and most importantly, we see it in our protective services programs that someone can be in a difficult and challenging situation at home and in need of protective services. And once we have some folks that can go in and do the appropriate assessments and we determine there's a mental health problem or a substance use disorder, it's our job to help that person access those services. Again, because the consequences are so severe if they do not get these services. There are 3 specific older adults groups that we're working to assist. Number 1 is individuals that have a long-term mental illness, meaning people that have lived with a substance use disorder or a mental health problem for many years. This group is actually the easiest to get services for because they're usually well known to the mental health system and to the drug and alcohol treatment system. They're folks that have been in the system. Those are the folks we can generally get the help they need pretty easily. The second group is a little harder, and these are folks that develop a mental illness and or a substance use disorder late in life. And originally, when we first started this initiative 4 years ago, we would sometimes hear some pushback that, well, if somebody hasn't been diagnosed with a mental health problem before they're 60, is it really, can we really validate that in indeed it is an SMI, serious mental illness. And we're here to tell you that it is, and that happens every day. And we need to get our older adults the services they need. There's also a lot of older adults who have been living with a mental illness or living with a substance use disorder their entire lives, and yet they've never been diagnosed. The third group is our folks that have actually been diagnosed with a neurocognitive disorder, something like dementia. And in those instances, um, when they also have a co-occurring mental health problem or a substance use disorder, it makes it even more challenging for us to get that individual the help they need because of the dementia or the cognitive disorder. But what I want to emphasize right now is that we have got to get the care that these folks need, get the care to them, because all the research points to the fact that if we can get someone with a neurocognitive disorder, co-occurring mental health, co-occurring substance use disorder, and it's not too hard to imagine that if we can get them help for their mental health or substance use disorder, they're going to do better in terms of where they are with their neurocognitive disorder. There are a lot of biases that exist. Well, first, I want to say there's many reasons for limited access. I don't want to point the finger at, the mental health system or drug and alcohol treatment system. It's much bigger than system issues. There's all kinds of bias. One story that I share often is I was in the hospital once and had some surgery and had stayed overnight. And my surgeon came in, talked to me, left, went to the next room, and when she did, I heard an older woman say to her, I could tell just from her voice that she was an old. Of course, I'm an older woman. I'll be 71 in February, but she was even older. I could tell from her voice, and she said to the doctor, "But I'm so depressed." And the doctor said to her, "Of course you're depressed. You're 85 years old." Um, that is just absolutely unacceptable. And of course, I had a chance to talk to my surgeon the next time that I was in to see her. There's a lot of belief that, well, of course, someone's depressed, they're older, or let Uncle Joe continue drinking. He's been drinking all of his life and he's not hurting anyone. Well, he is. He's hurting himself and he's jeopardizing his independence. I had this problem with my mother. She, in her last 6 years of her life, when my dad died, and she had 6 years without him, and she fell and hurt herself badly and became addicted to prescription opioids. And I had two brothers that were saying, "Well, we know, Lynn, you're all about this recovery stuff, and but you're coming down too hard on mom. You need to let her take whatever it is she wants. She's 83 years old." And my response to them was, "You've got to be kidding me. Mom lives in a 2-story house alone. Her neighbors had been coming and finding her on the floor unconscious. And too many times there's a lot of just bias and misunderstanding. Fortunately, I was able to get the docs, and this was way back in 2013 when the height of the opioid epidemic was at its peak. And my mom was one of those older adults that were really getting way too much access. And I even remember having to get very assertive, borderline aggressive with her doctor, basically saying, look, you've got to help my mother manage her pain, no doubt, but she has to be conscious, and you're putting her at risk for other problems if you don't help her get what she needs. And they were able to titrate her down and get her the pain management she needed while allowing her to live safely until her last day she lived in her house. But there's so many other reasons. There's lots of stigma and denial. Families just don't want to admit that their neighbor, or excuse me, their family member has a serious mental illness, and it may be something that they've been hiding, their whole lives. There's still way too much stigma that exists as it relates to mental health and substance use disorder. For myself, I will tell you, it took me 5 years into my recovery. So about 30 years ago, I got very open and assertive about my recovery. The first 5 years, I was still trying to wrap my head around, I had a phenomenal job. I had my whole list of I nevers. I never, missed work. I never got a DUI. No one in my family ever complained. But I knew that I had a serious problem with alcohol, and I knew that I'd had it for a very long time. And it was only because of my physical health, the deterioration of my body, that I finally had to look in the mirror and say, Lynn, you got to bite the bullet. And so it took me a while before I could really go public. And I know there are some folks that are in recovery that choose to never share with, I'll share it with anyone, anywhere. Just the whole issue of addiction or alcoholism or substance use comes up. And I'm very open about how grateful I am every day for my recovery. I had a 90-day partial hospitalization program that just saved me, basically, and a wonderful program called Women for Sobriety. If anyone's out there and hasn't heard of it, please Google womenforsobriety.org. AA was extremely instrumental in my first several years of recovery, and then I found Women for Sobriety. But those are the kinds of things that, we need to find a way to be more open and understanding of these issues in our communities. There's such a need for education, especially as it relates to older adults. We have lots of problems in our emergency departments, our hospital folks. It's amazing how high-level medical providers just have a lot of trouble understanding, in some instances, understanding mental health and substance use disorder, especially, as I said, as it relates to older adults. All kinds of financial barriers, especially Medicare, and that Medicare falls into both of those categories: financial barriers and regulatory barriers. And the other issue, of course, is provider staffing shortages. Everyone across the Commonwealth and this country are having problems with staffing shortages, and which creates waiting lists. And I used to say when I worked in my previous job in working for mental health and substance use disorder providers, I remember saying to the secretary for the Department of Corrections, what do you think a heroin addict is doing when they're on a waiting list for methadone? And his response to me was crystal clear. And I couldn't have said it better. He said, they're making their way to me. And those are the kinds of, when we're looking at waiting lists, especially as it relates to substance use disorder, well, it's the same for mental illness. There are just so many implications if we can't get the services we need. All kinds of access issues that relate to transportation, technology. We want to do more with rural health folks to help improve telehealth, but we have a lot of work to do in that arena. The consequences of no services are huge. Some of them I've already shared with you. Without a doubt, it reduces the quality of life. And that's easy to wrap your head around. No doubt, jeopardizes independent living. One fall is all it takes sometimes for an older adult. The whole area of other health issues that occur, one of the big issues, for instance, is that older adults process drugs and alcohol in a different way as we get older. And so what someone has been using for a long period of time can have a very different effect on them as they age. And we need to pay more attention to that. The other big issue is the risk of suicide is increased, and especially for older men, 65 plus. And generally, if alcohol is involved or an untreated mental illness, of course, we're gonna see an increased risk of suicide. Crazy amount of healthcare costs. I know I will tell you this, before I went into treatment, I had all kinds of health issues. Of course, I had all kinds of gastrointestinal problems going on. Nobody ever asked me, you know, are you drinking a gallon of wine a night? I'm exaggerating a tiny bit, but not a whole lot. No one ever asked those questions. They just sent me for brain scans and, all kinds of testing for, and those costs back in those days, and this is back in those days, boy, that really makes me feel old, but it's true. I mean, we didn't have electronic charts, and my healthcare chart was like this. And wow, once I got free of alcohol, my health just skyrocketed from that point further. So lots of healthcare costs involved, untreated issues like this. We're having major problems for our older adults with emergency department overload and the crowding that exists in emergency departments, because we'll have an older adult that ends up there, and then they try to find a placement somewhere for that person to get the care they need, and they have a lot of trouble making that happen. So it ends up, we have one gentleman in Armstrong County that his issues are mental illness, and he basically was stuck in is stuck in an acute care. This is an acute care mental health uh, office in a hospital, in a department, in a department in the hospital. And he has been living there since January 11th of 2005. It'll soon be a year, and that is just unconscionable. We've got to do better. We've got to find placements for folks who need the care that they do. The other issues, of course, and I'm sure a lot of you that are here know this, that untreated addiction and untreated mental illness highly increases the rates of incarceration and homeless, especially among our older adults. I can't tell you how much work I do on a regular basis trying to find placements for folks that are coming out of the criminal justice system. The cost to families, we all know what that's about. When you have a family member that has a serious mental illness that's untreated, or a substance use problem, it just brings other issues and creates quite the challenge. Next slide, please. This one is here to alarm you. I can't emphasize this enough. We are about to and by the way, when I first started this job 4.5 years ago, I referred to it as a silver tsunami. And then I learned from our national aging experts that we really want to stay away from terms like that, because when you think of a tsunami, you think of, a horrible, tragic event that just wipes out an entire uh, beachfront or country, or this is, we don't want to use terms like that, but we we aren't prepared, and that's what I'm trying to emphasize here, that in just my slide says 4.5 years. Now we're looking into 4 years and 6 weeks where we're going to be seeing a 39% increase in the number of older adults, number of people who are over the age of 60. And this, of course, are the baby boomers, my generation, that is creating this major increase. For the first time in history in the United States, which I think this number is pretty mind-blowing, older adults will outnumber children for the first time ever. And in 2030, 60 and above will account for 1 in every 3 Pennsylvania citizens. We are not ready. We need to do more to help our systems prepare for the increasing numbers, because you know as well as I do that as our number of older adults increase, there are going to be more folks with higher level of need than what we are prepared to serve right now. The suicide issue I mentioned earlier, but you got to look at this number. The suicide rate for males 65 plus is 30.2 per 100,000. Compared to all populations in Pennsylvania, it's 13.1 100%. 100,000, I mean, per 100,000. That is pretty scary. And all of that data comes from an expert in Montgomery County, Tony Salvatore, who also sits on our older adult committee of the Mental Health Planning Council and works on, is an incredible expert in the area of suicide prevention. What can we do to improve our situation and improve access? One, we have to, and this sounds really simple, but acknowledge this is not a new population. This is an underserved population and a growing population with unique barriers to treatment. And in fact, when I first started this work 4.5 years ago, I called some of my friends in drug and alcohol treatment because I represented providers and mental health providers and drug and alcohol treatment providers for almost 30 years. And when I contacted them and said, hey, what are you doing to serve older adults? And I actually heard that term from more than one person that I contacted, and that is, Lynn, we are overwhelmed with all of the folks that we're serving right now. We can't take on a new population. And my response, of course, was instant and said, geez, you gotta rethink what you just said, my dear friend. I added that. I don't want to create a major challenge here, but this is not a new population. I just got a year older, or for me, it's 11 years older. But when a person turns 60 and is considered an older adult, they just, like I said, they just got another year older, and we've got to make sure. In fact, I'm digressing for a second, but I was just looking at the mental health crisis regs, and one of the things that the Older Adult Committee and my state association are recommending is that the crisis regs right now, it specifically says that the target populations are adults, children, and youth. We want to see that changed to say that the target populations are adults, older adults, children, and youth, just to make sure we're right there up front and central when it comes to building out programs and meeting needs. Again, that the barriers are significant, and what we're doing is trying to pull those barriers out and do what we can to address them where we can. We're definitely working to advocate for parity. One of our biggest problems is Medicare. And when I asked all my old friends and members that I served, why aren't you billing Medicare? And the response was, Lynn, I'd go out of business if I was billing Medicare. The reimbursement rates are too low. The requirements are too intense when it comes to paperwork and credentials of staff, although they've opened that up some to allow for mental health counselors and marriage and family therapists. So we're so grateful for that. But we have a lot more work to do to remove some of those barriers. And we're working very closely with the Office of Mental Health and Substance Abuse Services and the Department of Drug and Alcohol Programs, especially the Deputy Secretary, Kelly Primus. She just came in October and presented to all of our area agencies on aging about the work that the Department of Drug and Alcohol is doing to improve access for older adults. And we'll be talking more about that later. But we definitely need to increase the number of providers that are willing to prioritize older adults and that will help to establish some special initiatives. We're working with all of the behavioral health managed care companies. We're working also with the community health choices programs that represent older adults that are nursing facility eligible, that are either in a nursing facility or at home, but nursing facility eligible, and trying to do what we can to help educate and improve collaborations across the board. Working very closely, and it's been phenomenal with these task forces that we've developed. Mental health administrators and substance use providers have just been spectacular and very interested in helping us. One, by the way, Lehigh County single county authority said to me one time that he was being forced to spend a lot, way too much of his state funding for underinsured Medicare recipients because there was no Medicare provider in their community. And it was impossible to bill Medicare. And yet, they didn't qualify for Medicaid. We've got to start to address some of those issues because they're going to be increasing, and we need to get more funding to our county mental health programs, our county substance use disorder treatment programs, and I've got to emphasize more funding for our AAAs. This is one of our successes I want to brag about. And Ashley, can you tell me, I can't see the number of my slides. What number are we on?
You're on slide 20.
Great, thank you, dear. So this was very exciting because we were able to get a bulletin issued, and this relates more to the mental health side than it does to substance use disorder, but it includes substance use disorder in these discussions, as you know. But what we were basically asking was to make sure that a message got out to the crisis programs and mental health providers that no assumptions could be made about an older adult and no decisions could be made until the appropriate assessments were done. What was happening in some parts of the state 4.5 years ago, and before I even share that, I want to say it has improved dramatically. But what was happening in some areas is that the crisis program, when they found out that a call was coming in, whether it was the police calling them or someone else, and when they heard that that person was 80 years old or 85, whatever, they would tell that other entity that contacted them to call their AAA, that this was an aging issue, this was a dementia issue, this was not a mental illness, or and even if there was a substance use disorder involved, it was the AAA that they should contact. That could not be further from the truth. Our area agencies on aging do not provide mental health services. We do not provide crisis services, and we do not provide drug and alcohol treatment of any kind. And we were able to get the Office of Mental Health and Substance to reissue this bulletin. It helps to have been around for a very long time because we were able to get it reissued. Next slide, please. These are just some of our successes. I'll just go over quickly because I definitely want to leave time for some questions. The Governor's Council, Advisory Council is working on all of these issues. A report's going to be coming out soon. I was fortunate enough to be chosen to be a part of that. Many thanks to my secretary for the Department of Aging and their commitment to working to improve access to these vital services. I've mentioned the Older Adult Committee of our Mental Health Planning Council. We're doing some good work. We have a lot more to do, but we're getting some. I've mentioned our task forces. The Philadelphia model is a model that has been developed to assist older adults who need nursing facility care and cannot access it because of a substance use problem or a mental illness. For instance, one unbelievable example, but it's a fact. We had an older adult in Lehigh County that we were trying to find a nursing facility placement for, and she was on buprenorphine and had been on buprenorphine for many years and was doing good, but now she needed skilled nursing care. And so unfortunate because the response from the nursing facility was, we cannot manage buprenorphine here in the nursing facility, but we will take her if you put her back on the opioid. Which, of course, anyone that's in the drug and alcohol community hears something like that, and it just has to make, your skin crawl and your hair stand on end, because that is absolutely the worst thing we could ever do for our older adult. And we were finally able to find a placement for her, but it was in New Jersey. But we're working right now. The Philadelphia model is the kind of thing that we're working to help our nursing facilities build capacity to provide care to older adults with a mental health or a substance use disorder problem. Another example, quick example of that, is we had an older adult up in Williamsport who needed nursing facility care, but she was an active alcoholic and needed to be detoxed. They would not take her and we couldn't find a drug and alcohol program that had the level of skilled nursing that she needed to do the detox for her. And so we were finally able to do an ambulatory detox. Fortunately, the family had pretty significant funds and were able to fund that. But we've got to do better. Next slide, please. Actionable steps. These are some of the things that we're working on to do better, meet older adults where they are. We're working on trying to increase telehealth and in-home mobile care. Older adults, again, if we're going to meet them where they are, we've got to talk about those issues. Increased number of Medicare providers for both mental health and substance use disorder. We are working very hard to address the whole issue of co-occurring with neurocognitive problems, and we've already talked about helping the stakeholders to assist nursing facilities in building more capacity. Lots of training needed, of course, always. These are just some quick, helpful hints. If you know someone who needs mental health or substance use disorder services, the very first question you have to ask, and I know a lot of folks on this call already know this, and that it, or in this webinar know this, and that is you've got to find out what kind of insurance they have. That's the very first thing. And if they have Medicaid and Medicare, I can tell you from my experience, we have been having a much easier time of getting them the help they need. And that is thanks to our behavioral health managed care system, which I can't say enough good stuff about the work that they are doing. And they have been very involved with us in the last 4 years on working on these issues and trying to improve access for older adults. But that's the first thing. What kind of insurance? If they have Medicaid and Medicare, we have a good shot. Medicare only is much more challenging, but that's when you need to reach out to your local drug and alcohol administrator or your mental health administrator to talk about what services might be available in the community and how our individual might be able to get some financial assistance. The last is thing that I want to say is this is another example. If they have no insurance or limited income, and this is when we have an older adult who isn't yet 65, so they don't even have Medicare yet. Again, we've got to get in touch with the county administrators to, and I know there are some county administrators on this call, and they're probably thinking, no, I'm sure. I don't know exactly what they're thinking. My guess is they're getting these calls every day right now, and the calls are going to be increasing without a doubt. We've got to get more funding into these programs. No question about it. Our single county authorities, our mental health administrators, they have got to have increased funds to serve. And I know I've said that several times, but next slide, please. This is the E4 Center, and this is where I'm finishing up. If you don't remember anything else I say in this, please know that Center for Excellence in for serving for addressing behavioral health disparities in aging. And they got a grant 5 years ago from SAMHSA to focus on where the disparities exist and what can be done to improve. And they have been a great partner to us in Pennsylvania. And they have lots of free training available on their website. So I encourage you to check that out and to share this website with anyone you know who is interested in the area of mental illness or substance use disorder that affects older adults, because they're a gold mine. And unfortunately, given the new administration in Washington, they just lost their funding at the end of September, but they continue their efforts in this area, minimum for at least the next year. And then I think my last slide, which is just my contact information. This is me, and this is where I can be found. I encourage you, if you have any questions that you don't get answered today, and you have any concerns or issues or things that I've said that you'd like to challenge, I am so interested in hearing them. I have been learning so much in the last 4.5 years, and I know for a fact I have a lot more to learn. So please don't hesitate to reach out and teach me. I am very anxious to hear. So tell me, are there any questions, Ashley, or any thoughts at all?
Thanks so much, Lynn. We do have a few questions for you, and we've seen some engagement in the chat. So I'll go ahead and start facilitating our Q&A. I'm seeing one come in right now. Can you say more about what Kelly Prius from DDAP shares about upcoming programs? SEAs need help in paying when Medicare doesn't cover, which is usually the case, is what the question says.
Right now, I know there are a number of projects that are in play what Kelly came to our meeting to talk about was a special, I mean, and this is so incredibly exciting. I can't even begin to tell you. I mean, I worked with the Department of Drug and Alcohol program since its inception, and actually before that, when it was an Office of Drug and Alcohol and when it was a Bureau of Drug and Alcohol. And I've never heard anyone from that department talk about the unique needs of older adults. But one of the programs that Kelly came and spoke about is a program that could be based in a AAA, in an area agency on aging. And it's all about improving, or rather reducing, the issue of opioid overdose. And I know a lot of folks that are on this call know that opioid overdose numbers have started to decrease a tiny bit, but they are not decreasing when it relates to older adults. We've actually seen increases in older adults that have overdosed on opioids. So it's a program called WISE. It's WISE, and I should be able to tell you what that acronym stands for, but I can. But it's a wellness program. It's a 6-week program, and it talks a lot about taking care of yourself and trying to address issues of the potential for abuse with various medications and substances. And I know they're working on a lot of other things. Jody Skiles, who also is a good friend of mine and works for the Department of Drug and Alcohol, she is actually on our task force that's working on building out these hubs to help our nursing facilities provide care for older adults that have substance use disorder problems. And we have the Department of Drug and Alcohol involved in pretty much everything that we're doing right now. When we call OMSAUS, we call DDAP. And we've had nothing but welcoming and supportive responses. I hope I answered the question.
Thanks, Lynn. I'm seeing some more questions in the chat. One from Kimberly here. Would you recommend looking at new models for treatment to specifically accommodate older adults in the next few years? And if so, what training agencies do you recommend linking up with?
Well, I would definitely link up with the E4 Center. They have lots of training available. It's all free. There's a gentleman by the name of Fred Blow, Dr. Fred Blow, and his expertise is totally on substance use disorder as it relates to older adults. And it is mind-blowing when you start to learn about some of the statistics that he's sharing about older adults. One of the things I can tell you, I mean, because I'm in recovery and I have lots of friends that are in recovery, we kind of joke periodically about, well, there's a real incentive to not relapse, because we don't want to be put into a treatment program with 30-year-olds. I mean, I have a grandson that's 22, not that there's anything wrong with that. And I'm sure there are times that our paths can, but when I'm there needing to talk about where I am, having just experienced, long-term recovery, and it's difficult to be in a group where folks are focusing more on the immediate needs of younger people that are in very different situations and circumstances than older adults are. But Dr. Fred Blow and the E4 Center, check that out. Lots of good training.
Thank you. And I'm seeing some other folks drop things in the chat and sharing some resources. So thank you so much for that.
Oh, wonderful. That's great. Oh my gosh, that's fantastic. Let me just check that out too myself.
Yes, sharing some personal anecdotes as well. In the last few minutes of our webinar, just we'll close off with one final question. You mentioned, there's a lot of efforts underway. Is there anything that gives you hope about where we're heading when it comes to addressing substance use among older adults?
Well, I can definitely tell you right now that what gives me hope, and it's hard to say, I'm getting a little emotional, is just the response that we have had from so many entities across the board. I thought when I first started this, I was going to run into some resistance somewhere. And I have to tell you, it hasn't been that way. Mental health administrators, drug and alcohol administrators, everybody across the board has been, and I think it's because everybody knows and everybody is seeing it everywhere. I mean, there's not a time I do this presentation in person that someone doesn't come up to me and talk about their mother or their father or their Uncle Joe. I mean, these are real problems that we're all facing. And what gives me hope is how much support we have gotten. Office of Long-Term Living, I can't say enough great stuff. Randy Nolan, he's right at the top of his game on these issues. People are keenly aware of the problems, and they know that we've got to start working. We cannot wait another minute to address these issues.
Thanks so much, Lynn. I'll just close off this webinar with thanking everyone for joining and being active participants in the chat. As I mentioned, all of this information is recorded. It will be available on our website. We'll also have slides available on the website for those of you that want access to that information. We shared Lynn's contact information in the chat. And for any certificates of attendance, I've seen a few comments asking about those. Please feel free to send me an email. I'll drop it in the chat right now as well, so you all have it. But with that, thank you so much for joining today. Very excited to be able to meet with you all, and I hope you'll have a wonderful rest of your day.
Absolutely. I second that. Thank you all very much for your time. Thank you, Ashley, for this opportunity. Take care.